Good evening, everybody. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and today's video is type 2 diabetes, sulfonylureas, and when to use them. So if you've watched the other videos on treatment of type 2 diabetes, I mentioned that when I talked about the different medications we use, I did not talk about sulfonylureas, but I want to address that here in this video. These sulfonylureas are some of the first medications that we had to treat type 2 diabetes after metformin. When I was going through medical school, almost all patients you started on metformin, and then if they weren't controlled on metformin, then you went to a sulfonylurea. These are medications with the "ide" at the end, glimepiride, glipizide, those types of medications. They work by forcing the pancreas to make more insulin. And so if you really understand the process of type 2 diabetes, it kind of makes sense why they have fallen out of favor. Because the issue with type 2 diabetes is that the insulin doesn't work well. Your pancreas puts it out and it doesn't function. And so taking a medicine that just pushes more insulin out technically works because it just overwhelms the system, but it can cause a lot of undesired problems. One of the main issues you have when using sulfonylureas is low blood sugars, hypoglycemia. Because it doesn't matter if the blood sugars are high or low, it will force the pancreas to pump out more insulin. There's also some thought that these medications can actually wear the pancreas out quicker because they're kind of revving it up and keeping it going and going and going, and so you may actually quicken the progression of pancreatic demise per se. And so if you look at the current endocrine society guidelines, most guidelines on which medications to use for diabetes, sulfonylureas are kind of at the last. And there's always this caveat because in one of the issues with primary care, especially underserved primary care, which is what I work in. Okay, so I work for a federally qualified health center. Almost all of my patients are either Medicare, Medicaid, or not insured. So the one thing about these medications, they will bring blood sugar down and they're very, very affordable. You do not need insurance to be able to afford these medications. And so they are still used, and you'll see them used. You'll have patients coming in and they'll say, "Hey doctor, I take metformin and I take twice a day, I take glipizide once a day, and my sugars have been great." They've been well controlled for years on that regimen. When that happens, I say, you know what, it's working. If it's not broken, don't fix it, and I just leave it alone. If patients are getting older, above the age of 60, above the age of 65, I really hesitate to keep them on a sulfonylurea because of that risk of hypoglycemia. So, geriatric patients who are still on these medications, it's best you take them off and try to find something else to do. Young, healthy people who are doing well, that's okay. If you have people who do not have insurance and they cannot afford medications unless they're very inexpensive, you may find yourself reaching for sulfonylureas in order to fill that gap. Okay, so they are diabetic medications. They do work, but they do have some serious problems. Now, all medications have side effects. All medications have times when you should use them and when you shouldn't use them. And so I don't want to have a horrible rap on the sulfonylurea medications, but I'm doing my part to kind of continue that process in which we keep moving these medications down lower and lower in our algorithms as how we treat type 2 diabetes. So keep that in mind. If you've got metformin on board and they're on a sulfonylurea, that's the glipizide, glimepirides, those medications, they're doing well, that might be fine. If they're older, get rid of those medications. If they're not doing well, if they're on metformin and they're on glipizide and it's not working, get rid of the sulfonylurea. Their pancreas may have already run out of beta cell function and they're not making much insulin anyway, and giving them a medicine to just try to squeeze more out might not be very helpful. And so those are the sulfonylureas. When you use them, when you don't use them, and stay tuned for more information. Have a great night.